So the attitude towards breastfeeding in India is generally influenced by social, cultural, and economic factors. In fact, many women fail to openly share their problems, and choosing between work life and breastfeeding becomes quite challenging for them, whether be it breastfeeding or maternity concerns. World Breastfeeding Week gives us an opportunity to educate, promote, and support progressive trends to normalize breastfeeding as a special bond between the baby and the mother. Today we have with us Dr. Sumita Saha, who is a neonatologist and a pediatrician at Fortis Hospital Kolkata, to discuss with us all about breastfeeding. Welcome, Doctor, to India.com and the health site.
Hello.
Hi, Doctor. So, we have a lot of myths around breastfeeding that if you have small breasts, you can't produce enough milk. What is your take on this?
That is absolutely wrong. In fact, we as a doctor has a different feeling that even those who are small breast sometimes produces more. So the size of breast doesn't match anything with the amount of breast milk produced. So that is absolutely wrong myth.
Right, doctor. So another myth is that mothers should be eating only bland food while they are breastfeeding. So what is your take on that?
So the concern is if the mother get too much spicy food, that sometimes causes colic. Now colic is common in breastfed and bottle-fed, both type of neonates, small babies, because they gulp air during feeding. So during sucking they gulp air and that causes the colicky pain. Now mother should of course and should take the proper nutritious diet with lots of protein, vitamins and minerals, but spicy doesn't cause too much of problem. At least our book doesn't say that. I know lots of grandparents say that if you take spicy, your baby will have more colic, but there is no specific evidence regarding that.
Right, doctor. Also, there's another myth that if you're sick, you cannot breastfeed. So is it really true?
No, absolutely not, because there is only few virus which goes through the breast milk. One is HIV and one is hepatitis B, and not any virus otherwise goes through the breast milk to the baby. In fact, if mother get infected with some virus or bacteria, the mother's body produces the antibody, and that antibody goes through the mother to the breast milk to the baby, and that gives some protection to the baby. So ideally, if the mother is sick with any other infection other than HIV and hepatitis B, the mother should breastfeed. Now, what happens during breastfeeding? The important thing is to maintain the hygiene, and hygiene is two things. One is the infection go through the hand. So if mother has got cold with the respiratory viral infection, and mother sort of rub the nose and handle the baby with that hand, that can spread to the baby. Or other thing is the mother, if is sneezing and coughing, and that virus can go from mother to baby through the just aerosol, through the air.
Yeah.
Important, the mother has got cough and cold, mother can use some mask so that directly the sneezing, coughing, the respiratory particles doesn't go to the baby, and wash hand regularly so that they do not give the infection through the hand. But of course, carry on with the breast milk so that mother can give the antibody to the baby.
Right, doctor. So now we need to, this is we're having this breast feed week this whole week. So we need to spread more awareness regarding that. So how do one know if the milk is sufficient for the baby? When do we stop?
Yeah, so this is very common question. Most of the mother ask that how do I know that I am producing adequate breast milk? There is quite a few things. In fact, initially it is difficult to understand whether mother is producing enough milk, because first few days the colostrum will come, and that is very little in amount. So what happened first few days, babies usually lose weight. And scientifically, we said up to 10% weight loss is normal. So for a 3 kg baby, they can lose up to 300 grams of weight in first 7 days. But if the baby lose more than that, then we think whether the baby must be having less feed than what the baby requires. So one is the amount of weight gain or weight loss. Number two is the sleep awake cycle. So usually baby feed for 20 minutes to 30 minutes and then sleep for a couple of hours, and that should be the cycle. Now if one baby is crying every minute, every 15 minutes, then there might be a lot of other possibility, but there could be one cause could be that baby is not getting adequate milk and baby is hungry. So that cycle we should be following. And number three is the urine output. So baby should be passing at least 6 urine per day. If the baby pass 20 times a day, that means of course the baby is having adequate milk. But if the baby is passing less than 6 times a day urine, then that says that possibly baby is not having adequate milk. In that case, we again weight the baby. And for, as I mentioned, the first 7 days they lose weight. By day 10, they are supposed to go back to their birth weight, and from day 10 onward, they gain around 30 gram per day. 20 to 40 the days, 30 gram per day. So when they come back to follow up in a week or 2 weeks time to our pediatrics OPD, we check the weight in electronic scale and try to find out whether they have got adequate milk.
Right, doctor. So, they should, all the breastfeeding and lactating mothers, they need to maintain hygiene and need to make sure that they're having proper nutritious food and also taking care of their mental health. So these three things need to be followed to the Q. Thank you so much for taking out time for India.com.